If your lower back hurts, your hips are probably the reason. Not your spine, not your posture, your hips. I know that sounds wrong. The pain is in your back, so the problem must be in your back. That's the logic almost everyone uses, and it's the reason most people treat back pain for years without ever fixing it. Here's a quick test. Stand up right now. Put your hands on your hips. Now try to pull one knee up towards your chest as far as it goes. Can you get it above your hip level? If not, your hip flexors are tight, and tight hip flexors are pulling your pelvis forward, compressing your lumbar spine, and generating the back pain you feel every single day. This connection between your hips and your back is one of the most important things I teach my patients, and one of the least understood problems in mainstream medicine. Today I'm going to show you exactly how your hips are destroying your back, why it happens, how to test yourself, and the exact protocol that fixes it. Stay until the end. The last section has the 3 exercises that reverse this in 8 weeks. Without them, everything else I tell you today is incomplete. To understand why your hips destroy your back, you need to understand one muscle most people have never heard of. The iliopsoas. It's actually 2 muscles, the iliacus and the psoas major, that function as one unit. The psoas originates from your lumbar vertebrae. The bones of your lower back runs through your pelvis and attaches to the top of your femur, your thigh bone. Read that again. The psoas attaches directly to your lumbar vertebrae. This means every time your iliopsoas is tight or overactive, it pulls directly on your lower back. Not indirectly, not through a chain of compensations, directly. It attaches to the spine and pulls it forward. When you sit for hours, which most people do, the iliopsoas stays in a shortened, contracted position for hours at a time. Over weeks and months, it adapts to this shortened length. It loses its ability to fully lengthen, and every time you stand up and try to walk, it pulls your lumbar spine into excessive extension, compresses the posterior elements of your vertebrae, and creates the exact pain pattern that gets diagnosed as lower back pain, disc problems, or facet joint syndrome. A 2017 study in the Journal of Physical Therapy Science found that iliopsoas tightness was present in over 90% of patients with chronic lower back pain. 90%. And yet, the standard back pain treatment, physiotherapy, anti-inflammatories, core strengthening, almost never directly addresses the iliopsoas. Here's the mechanism in simple terms. When you sit, your hip is flexed at 90 degrees. In this position, the iliopsoas is shortened. It's not working, it's just sitting there in a compressed state. Your nervous system is extremely efficient. If a muscle stays shortened and unloaded for long enough, the brain recalibrates its resting length. It starts to treat the shortened position as normal. After 8 hours of sitting, which is the average for most adults over 35, your iliopsoas has been in a shortened position long enough to begin losing its ability to fully lengthen. This is called adaptive shortening. The muscle doesn't just feel tight. It structurally changes to accommodate the shortened length. Now here's where the back pain comes from. When you finally stand up and start walking, your iliopsoas should lengthen to allow full hip extension, the backward movement of your leg behind your body. If it can't fully lengthen, your pelvis compensates. It tilts forward, anterior pelvic tilt, to allow the leg to move without stretching the tight muscle. And when the pelvis tilts forward, the lumbar spine follows it into extension. The vertebrae compress posteriorly. The discs experience asymmetric loading. The facet joints grind. This happens with every single step you take. Thousands of repetitions per day of this compensated movement pattern, and you feel it as chronic lower back pain that never fully goes away because you're recreating the compression with every step. Do you feel tightness at the front of your hip when you stand up from a chair? That's your iliopsoas. Do you find it hard to stand fully straight after sitting for a long time? That's your iliopsoas. Do you arch your lower back when you try to stretch your legs behind you? That's your iliopsoas controlling your pelvis. I want you to do a test right now that will tell you immediately whether your hips are the source of your back pain. This is called the Thomas test. It takes 30 seconds and requires nothing except a flat surface. Lie on your back on a bed or a firm surface with your legs hanging off the edge from the knees down. Pull both knees to your chest, then lower one leg down while keeping the other pulled to your chest. Here's what you're looking for. If your lowered leg hangs straight down or close to it, your iliopsoas has adequate length. If your lowered leg rises up, stays elevated, or if you feel a strong pull at the front of your hip, your iliopsoas is tight. If your lowered knee extends and points outward, your tensor fascia lati is also involved. Try both sides. It's extremely common to find significant tightness on one side and less on the other, which explains why lower back pain is often worse on one side. I use this test with every single patient who comes to me with back pain. Over 80% fail it on at least one side. And in almost every case, when we address the iliopsoas tightness directly, not the back, not the core, not the posture, the back pain improves faster than with any other intervention. A 42-year-old teacher came to me after 3 years of lower back pain, 2 rounds of physiotherapy, 1 cortisone injection, no lasting improvement. She failed the Thomas test dramatically on both sides. 8 weeks of specific hip flexor work, the protocol I'll show you at the end, and her back pain was 80% resolved. She's been pain-free for over a year. Watch to the end. I'll show you the exact protocol I gave this patient. Let me show you exactly what tight hips do to your spine over time. Because this is what makes the problem urgent, not just uncomfortable. When the iliopsoas pulls the pelvis into anterior tilt, the lumbar curve increases. This is called hyperlordosis. The posterior elements of the lumbar vertebrae, the facet joints, the spinous processes, the lamina, start to compress against each other. Initially, this feels like stiffness and aching. Over months and years, it leads to facet joint arthrosis, degenerative changes in the small joints of the spine that are painful, progressive, and largely irreversible once they're established. At the same time, the anterior tilt changes the load distribution on the intervertebral discs. The L4 to L5 and L5 to S1 discs, the 2 most commonly herniated discs in the human body, experience increased posterior pressure. This is the mechanical precursor to disc herniation. Not one dramatic injury. Years of abnormal loading from a pelvis that's being pulled forward by tight hip flexors. There's one more consequence that surprises people. Tight iliopsoas directly compresses the lumbar plexus, the network of nerves that runs through and around the psoas muscle itself. This nerve compression can cause symptoms that get misdiagnosed as sciatica, hip flexor tendinitis, or even abdominal pain. The nerve runs right through the muscle. When the muscle is chronically contracted and hypertonic, the nerve gets squeezed. This is why some people with tight hip flexors experience not just back pain, but groin pain, anterior thigh pain, and even symptoms that feel like digestive discomfort. It's the same compressed nerve producing different symptoms depending on which branch is most affected. Standard back pain treatment addresses the back. Massage the back muscles, strengthen the core, stretch the hamstrings, mobilize the lumbar spine, and all of these things provide temporary relief because they address the symptoms of a spine that's being overloaded. But the overloading continues because the thing creating it, the tight iliopsoas pulling the pelvis forward, is never touched. This is like mopping water off the floor without turning off the tap. You can mop forever. The floor stays wet. Core strengthening is particularly misunderstood. A strong core is important, but if your pelvis is tilted forward because of tight hip flexors, strengthening your core just makes you better at stabilizing a misaligned spine. It doesn't correct the alignment. In some cases, it makes the compression worse because strong core muscles hold the spine more rigidly in its already compromised position. Stretching the hamstrings is another common mistake. The hamstrings attach to the bottom of the pelvis. When the iliopsoas pulls the front of the pelvis down, the hamstrings resist by pulling the back of the pelvis down. They're trying to maintain balance. They feel tight because they're working overtime as a counterbalance. Stretching them removes their ability to resist the anterior tilt. The pelvis tips further forward. The back pain gets worse after hamstring stretching, and this is a reliable sign that iliopsoas tightness is the primary driver. Subscribe right now. Next week, I'm covering exactly why the stretches most physiotherapists prescribe for back pain make the problem worse for 60% of patients, and what to do instead. Hit the bell so you don't miss it. Before you strengthen anything, you need to release the iliopsoas. A chronically tight muscle doesn't respond well to immediate loading. You need to restore its length first. The most effective release for the iliopsoas is the 90-90 hip flexor stretch. Kneel on one knee, the knee of the side you're stretching, with your other foot flat on the floor in front of you, knee at 90 degrees. Keep your torso upright. Squeeze the glute of your kneeling leg and gently push your hips forward until you feel a stretch at the front of the hip, not your thigh, specifically the front of the hip, deep to the quad. Hold for 60 seconds. Do not lean forward. Do not arch your back. The movement comes from the hip, not the spine. 3 sets of 60 seconds on each side every day. This is the minimum dose to begin restoring length to an adaptively shortened iliopsoas. The second release technique is the couch stretch. Place your back foot up on a couch or chair, with your front foot flat on the floor. Same upright torso position, same glute squeeze on the rear leg. This version gets a deeper stretch into the rectus femoris, the quad muscle that also crosses the hip and contributes to anterior pelvic tilt when tight. 60 seconds each side. Do these releases every day for 2 weeks before adding any strengthening. If you jump straight to strengthening with a tight iliopsoas, you're training movement patterns that are still being distorted by the tightness. Release first, strengthen second. Once you've restored adequate length to the iliopsoas, you build stability into the new range of motion. 3 exercises. Done in sequence, 3 times per week. Exercise 1, the dead bug. Lie on your back, arms pointing to the ceiling, knees bent at 90 degrees, lifted so your shins are parallel to the floor. Slowly lower your right arm behind your head while simultaneously extending your left leg straight, keeping both hovering just above the floor. Return to start. Alternate sides, 10 repetitions each side, 3 sets. This trains deep core stability without any spinal compression, and specifically targets the muscles that hold the pelvis in neutral position against the pull of the iliopsoas. Exercise 2, the hip flexor march. Stand tall. Lift one knee to hip height. Hold for 3 seconds. Lower. Alternate legs. This trains the iliopsoas to work at its proper length as a hip flexor rather than as a spine compressor. 15 repetitions each side, 3 sets. Exercise 3, the reverse lunge with reach. Step back into a lunge with your right foot. As you lower, reach both arms overhead. This simultaneously stretches the rear hip flexor and activates the anterior core and glutes in the correct relationship. 10 repetitions each side, 3 sets. Weeks 1 and 2, release only, 90-90 stretch and couch stretch daily. Weeks 3 and 4, add dead bug and hip flexor march. Weeks 5 through 8, full protocol including reverse lunge. By week 8, the anterior pelvic tilt that has been compressing your spine will be measurably reduced. Most patients feel significant improvement in back pain by week 4. Your back pain is not coming from your back. It is coming from hips that have been shortened and tightened by years of sitting, pulling your pelvis forward, compressing your lumbar spine, and loading your discs and joints in ways they were never designed to handle. The solution is not to treat the back. The solution is to release the hips and then build stability into the correct pelvic position. 2 weeks of daily releasing, then 6 weeks of progressive strengthening, 8 weeks total to undo what years of sitting have done.